Welcome back, everyone. Ali here again. I don't know if you missed me, but I definitely missed all of you. I absolutely appreciate, and our team at the law firm and HR for Health absolutely appreciates all the positive messages and emails and text messages and of course the great questions that you all are asking regarding all of the things that are happening. We have been away for a little bit, about a week or so, because we didn't want to just focus on giving you information. We wanted to focus on the context of this information so that we can absolutely make sure that it's applicable to you today. So there's a little bit of information overload. I know a lot of you feel that way. And so my goal, and I think our goal here, is to always give you this information that we think is most pertinent to you right this second, but more importantly, in the context of where you are in your practice or your career. So we're going to break this down into really three big areas because I have a lot of information to cover with you, right? So things that you need to absolutely kind of know and start to implement and also talk to your advisor about. So one, we're going to talk about an update on kind of what's been happening most recently. There's a lot of information out there. I'm going to pinpoint on some very specific things. Then we're going to talk about things that we've heard in the industry that are happening amongst our community of dentists and practice owners, things that could cause liability, and so we're going to focus on those and give you very, very specific advice as to those. And then finally, we're going to talk about some strategies for you if you were lucky enough to get the loan, the PPP loan, I should say, or if you were not so fortunate and you have not gotten the loan, then we have strategies for both sides of that coin. And then at the end, I have an absolute special gift for you that I'll be sharing with all of you that I worked late into the night to put together because I thought it would be something that would be really valuable for all of you to use. So we'll talk about that at the end because we've got a lot of more important information to go through. I am going to reference my notes because there's a lot and I don't want to miss anything. So I apologize if I end up looking down. But please, if you have questions, make sure you ask them through this Facebook Live setting. I will be answering some Q&A at the end. I'll try not to keep us online for too long, but feel free to ask your questions. And if they're not answered during this seminar, I'll definitely try to answer them. And if we don't get to them at the end, we'll definitely email you back. So, as most of you know, what happened was that on Tuesday, just a couple of days ago, the governor came out and was going to tell us about his plan for reopening California and getting rid of the shelter in place. It wasn't as I think everyone expected because the impression that we got was that he was going to give us a date that we could all rely on where the shelter in place was going to be removed. However, what he did was he gave us 6 metrics that he's going to use to determine when that shelter in place is going to be removed. And so no specific date yet, although he did promise that in the next few weeks that he was going to maybe give us a date because he's seeing that the curve is flattening and that we're doing very well as a state, which is great news. Some other states, Oregon and Washington are following suit. On the East Coast, New York and New Jersey are trying to do the same as well. Now, why do I bring this up? The reason I bring this up is that there was one of those 6 criteria that he brought up that was of real importance to all of us in the dental world, and that was number 5. And if you look it up, if you end up looking up his talk and summaries of it, you'll see that the 5th item that he referenced, redrawing floor plans, is of vital importance to us in the dental world and in the optometric world. Why? Because that could change the way we operate, right, moving forward. And so there's a lot of lessons to be learned here because he referenced the industry, restaurant industry, and he said, look, we may open up, but we may not allow as many tables in the restaurant. We may not allow as many people in the restaurant, and so on and so forth. So you can think about that logic being passed on to other businesses like in the optometric and dental world. And so we have to keep that in mind. And the reason I say that is because there are potentially going to be some costs that come down the line with putting plexiglass and doing other things in the office, separating operatories, putting plexiglass in the front with the receptionist and other areas. And so there's things that we just have to be aware of and things that we have to be prepared for. Now, what we know is that OSHA has yet to come out with their formal guidance. I think they're working with CDC probably on this. As I had mentioned before, they're supposed to issue the guidance in about a week or so, but we think that by the end of April, we'll have some real information on what to do in the practices. But for now, what we know is that there may be serious changes to how we operate from a floor plan perspective. So kind of keep that in mind. Earlier this year, from one of our close partners, we learned that the SBA was going to potentially run out of money with the PPP loan by the end of this week, Friday. What we found out this morning is that they actually are out of money as of late last night. So the PPP loan now has been exhausted. As many of you know, the Congress is negotiating as we speak to try to expand that and allow for more small businesses to take advantage of the PPP loan. There have been millions of businesses who have not been able to take advantage of it, as many of you know, and I know a lot of you are in that boat as well. As this whole process has been very, very difficult on many of you. Our bankers in the dental industry have been working extremely hard, especially those ones in the dental divisions of those banks. And so it's not their fault by any means, but at the end of the day, we are where we are, and the system was just not sufficient enough to allow for all of you to get it. So we'll talk about those strategies, unfortunately, but we're keeping our fingers crossed that this next stimulus that they were hoping for, this additional, I think, $250 billion dollars would actually get passed, but we'll see if that actually happens. So don't lose hope just yet. So let's go into the first part of today's conversation, which really is about some updates to the FFCRA and some other related rules. Now, when we first started talking about this almost a month ago now, I mean, I don't know about all of you, but every day seems like a whole week has gone by because so many things changed. But a lot has even changed in this area. As many of you know, there's been some exemptions and discussions of are dentists exempt? And so I have a couple of updates for you. So as you know, last week or about a week and a half ago, there was some clarity that came out that talked about 3 criteria for which a small business that has less than 50 employees could be exempt from the FFCRA. So what am I talking about there? We're talking about emergency paid sick leave and emergency paid FMLE leave. What we know we have to provide to the employees once our doors open. There are some exemptions there. So you have to be smaller than or have less than 50 employees. You also then have to fit into one of the 3 criteria. Now, I won't go into detail into those today because there's other videos that we've done and we'll put out some articles if you want some more information. But basically, item A is your revenue or your expenses exceed your revenues and you can't be minimally open. Item B is that you have folks that have technical skills in your office that if they do not come to work, then you cannot operate. Now, for many of you, that could be the case because of, whether you have an optician or you have a hygienist or a specialized, RDA or surgical assistant that may allow you to use that exemption. You have to be very careful with it, but you may be able to use that. And then the third is that your entire team or a majority of your team does not come to work or refuses to come to work. And as a result of that, you cannot be minimally open. You can then use an exemption and in essence be relieved of any obligations under the FFCRA. So those are the real 3 exemptions. Now, through the hard work of the CDA and their lobbyists and other groups, what we now know directly from the Department of Labor is that dentists are not excluded themselves. This is a new update. So if you remember, the FMLA defines healthcare providers as including dentists, okay? Not their teams, but dentists themselves. And so there was no information, there was no guidance on whether they were going to change that. But what they have now told, various lobbyist groups is that that entity, right, or that group, dentists are not included as under the new definition of the healthcare provider under the FFCRA. So now what that means is that you have to make sure you fit under one of those three criterias if you're going to exempt your individual team members. Dentists themselves, meaning your associates, are not necessarily going to be exempt. Now, I know this is going to raise a lot of questions, a lot of concerns, because obviously your dentist associates and your optometric associates are highly compensated employees. Remember that every dollar you spend under the FFCRA, whether for emergency sick leave or emergency FMLE, is returned to you on your quarterly tax returns, payroll tax returns. So you just have to work with your payroll company, because dollar for dollar, you get a credit back. So it's more of a cash flow discussion than anything else. So although you may end up paying more out to your associates as a result of this new information, just remember you will get it back through payroll tax credits. Okay. All right. So now let's go into sort of the next part of this update, which is the $600 of unemployment that the federal government is giving the states. Now, as you know, the states have to play ball and they have to agree with the federal government terms. Most states have agreed to play ball, and so they will be giving the $600 a week to people who have filed for unemployment. Now, there's a lot of information, a lot of questions that we're getting regarding, well, what if my team doesn't want to come back? What if they're making more on unemployment? Let's say, the $400 max that California has, plus the $600 from the federal government, or whatever other state you might be in, you have different caps. What if they make more on unemployment? They just don't want to come back. And here's the reality of it, is that could happen. That could happen. Here's how we're advising our clients right now. There's two scenarios. One is, if you communicate frequently with your team, keep them advised of what's happening, of your plan of potentially opening up, of those things, we have seen that lower the chance that the employees will not want to necessarily come back. Okay, because a lot of them know that unemployment will end at some point, and that they need a job. And with almost 20 million people on unemployment right now, it's not like it was a couple months ago. And so jobs are harder to find, believe it or not. And so because of that, I think your teams will likely come back. Now, if you do open up for business, and we'll get to that actually, because there's a lot of questions about when I should open. But if you end up opening up, and your team refuses to come back, either one member or a bunch of members, you do have to have discussions with them, because you may be able to terminate them. Not that I'm recommending that at all, but you could do that, or you could work with them on figuring out a solution and accommodate them. So that is a real one-on-one, very factually specific situation. So make sure you're calling, either if you're an HR for Health customer, make sure you're calling HR for Health customer support, and our HR team is absolutely ready there. You can call us at the law firm, of course. If you're a member of the CDA, you can call practice support. If you're a Vision Source member, you can call their team and they'll handle it or refer it out. So just make sure that you are calling someone and getting a second opinion on this, because you don't want to just terminate just to terminate. So some of the things regarding that now, as we kind of talk more about the team, is what do I do if I open up? And by the way, we're going to have a lot more information next week and the following weeks about how to prepare to open up, because a lot of you are starting to think about that. Right now, it's probably still a little too early, but next week and the week after, we'll talk about sort of real strategic plans. But here's the reality of what you need to start thinking about with your team. The CDC has made it very clear that they are sort of expanding their rules and allowing you to ask questions that you wouldn't normally get to ask employees because of COVID-19. So you can take their temperatures. You can discuss with them if they have any symptoms that might imply that they have been infected, or they're around people who are infected. You can start asking those questions, which you normally wouldn't be able to do. Now, what the CDC is recommending is that, and the Department of Labor as well, is that you focus on the ailments that the CDC or other healthcare experts have identified with COVID-19. Right? So you don't want to ask about things that are totally unrelated. That's not necessarily allowed still, but things that are, right, potentially could be symptoms, temperature, obviously, dry cough, a variety of other things that they have put out. Those are valid questions to ask. Now, if you do take their temperatures, you do need to record that. Hopefully, you're putting it into an electronic system like HR for Health, but you do need to record that and make sure you have a record of it. Now, if they show a temperature, then you absolutely must record that, and you may need to notify your workers' comp carrier as well, because the assumption is now that they may have gotten it at work. So there's, work with your workers' comp carrier on that, but it never hurts to provide them that information. But more importantly, you can now notify, if you choose, the county and public officials about the fact that your employee has come down with a virus, or if you choose to do that because of health concerns and community concerns. So again, a lot of this is changing. A lot of this is very factual. So make sure you're working with someone on the HR side for a lot of this information, because these are the kinds of things that could potentially trip you up as we move forward. This information must be kept confidential, of course, and as most of you know, you should have two files with regard to your HR documents, one for normal HR documents and one for these health matters. So anything related to COVID-19 should be in this separate locked file. Of course, if you're doing it electronically like HR for Health, you're completely fine, because it's already separated and things of that nature. But if you're still doing it the old-fashioned way on paper or whatnot, then make sure you've got it separated, because it's very, very important to separate. Now, another related question that we get is, look, I have a pregnant employee, or I have an employee who is 65 years or over, or I have someone in their 30s and they take care of their mom or dad, and their mom and dad are in their late 60s. Can I either retract a job offer or delay their start date when I open up my office? And the answer to that is no. Okay, you have to be very careful. Just the fact that they're pregnant or older, or they're taking care of someone who's older, is not sufficient, based on what we've gotten from the Department of Labor, for you and the state of California, for you to delay the start date of someone, because they're afraid, of course, of discrimination. Now, I do think you need to have some conversations with them and have a communication line with them where you are really discussing these things and seeing if it's really prudent for them to start at that time. And if there's some accommodations that need to happen to maybe protect them and whatnot, then those things should be discussed as well, to see if it's viable for the business to do those. So we get that question a lot recently. So just make sure you're very careful about that hiring and firing side of things. Now, there are some low-cost solutions, and I say low-cost because it doesn't always seem like it's low-cost, but OSHA and CDC and others are throwing around a lot of ideas about what to do with regard to separating employees from patients, separating employees from each other, like I mentioned, plexiglass and other things. What I will tell you is that we don't know what kind of costs are going to come down the pipe. So, I recommend, and we're going to talk a little bit more about this later, is that you focus on your cash flow, save as much cash as you can, because we don't know what kind of costs are going to be necessary when we open up, because there are certain things that may be required for you to do. So just be careful, just make sure of that. Now, you do need to make sure your anti-harassment policies are up to date. So if you have an employment manual, make sure it's up to date. If you don't have an employment manual, please get one. Our team at HR for Health can help you. CDA can help you. Just make sure you get a manual, because at the end of the day, that is your first line of defense when it comes to that. So with regard, we're going to talk about best practices for the employees or whatnot. Next week we're doing a seminar, a webinar with CDA, I believe next Friday, and we'll be going through a little bit more detail on how to prepare to open up, which will be important on many different levels. But what I wanted to mention here is make sure that if you have employees who have been terminated, that you take all the right steps to rehire them all back on. Okay, very important, because remember, if you've terminated them, then they're legally terminated. So you need all the new hire forms. If you've never had an employment manual, this is the time to get it. Update your policies, make sure they're all in there, make sure it's exactly as you want, especially now with maybe what will happen with lack of revenues or a slowdown in revenues, so that you can handle the rest of the year well. And then, of course, for next year, if things come back to normal and revenues are back up, you can change your policies again there. All right, so let's move to phase 2 of today's seminar to talk about the potential liabilities that we see. We talked already about terminating employees. So be very careful about this, because I know that a lot of you are thinking of letting go of some employees. If you do that, we understand why, and we understand the reasons, and there's that is all business related. We understand, but you have to make sure that what you're doing is across the board with your team, and that you're not singling out any individual person. And so make sure you communicate with us directly. There are liabilities out there. There are plaintiffs' lawyers already talking to a lot of employees who have been terminated. We're already getting letters from them, and we're reacting very strongly, because we don't believe that there's any discrimination whatsoever. But that being said, you just don't want to be on that side of the coin as we try to ramp up and get back to normal. So if you have any questions about any of that, please don't hesitate to call my office directly, and we will walk through it. No problem there. Some other things we've seen out there is some antitrust potential violations. And that's not a common thing to talk about in dentistry, because it rarely comes up as an issue. But we have heard of dentists kind of getting together to pool and coordinate fees and things of that nature in small regions around the country and whatnot. I strongly urge you not to do that. There are activities that are okay for you to do, and then there are some that are not okay for you to do. And so coordinating your fees and your schedules and those kind of things are very, very dangerous to do. And so just be careful. The government has actually come out with an antitrust task force to combat this. Now, they're not targeting just doctors, dentists, optometrists, veterinarians. They're not targeting you specifically, but they have created a task force just for this, because they have seen the signs of it, and we are now seeing it as well, because groups are talking to us. So if you are thinking of getting in a group to do some things, we need to talk, we need to plan, strategize, so that you're doing things correctly, as opposed to engaging in antitrust behavior. So just be aware of that. The third item in this section is about HR documentation. So with all of this PPP, loans and the FFCRA and all these rules and regulations that are coming out, there's a lot more documentation that is now required. Documentation if someone takes leave under emergency sick leave or emergency FMLE. Documentation in terms of what happens if they get paid out and what needs to be sent to payroll, time clock documentation, anti-discrimination policies, employment manual updates. There's a lot that needs to happen right now. And since we have a lot of downtime, please get your HR house in order. Make sure you're compliant. It doesn't take long when we're all off and at home. It takes a long time, or it seems like it takes a long time when the offices are open and we're busy with life. But right now is the time to get compliant. So make sure you get your HR house in order. It really is not that bad. You can do it very quickly and easily. Get your policies in place. Our team will help you through it, the whole thing. So let's move to the third part before we get to the Q&A and the special gift that I have for you, which is we're going to talk about the third part. It has to do with the loans, the PPP loans. So I'm going to divide this into two sections. The first is for those who got the loan. If you're the lucky few who got the loan and you got your SBA number, before today, hopefully, or before yesterday, and you are going to get your money, we're going to talk about some things that you should be thinking about and doing. And then we're going to put out some more, very specific videos for you. If you didn't get your loan, we're going to talk about some other things that you can do as well from a cash flow perspective that nobody has really talked about yet, but is available to you. All right, so here's my first recommendation. I'm sure have heard me say this multiple times, but please open up a new bank account for the money that you're going to receive from the SBA. So make sure it's a new account so that you can track your expenses that are reimbursable through that account and only that account. It will make your life easier. If you're like any optometric or dental practice around the country, you have hundreds and hundreds of charges and credits and debits going through your accounts on a monthly basis. It's not something you necessarily want to share with the government or with your bank. And so open up a new bank account, keep it absolutely clean, and make sure that everything you run, payroll, rent, mortgage interest, and all these other things that are allowed, utilities and whatnot, you run it through that account, and then you keep PDF copies of it. Very, very important. Just makes it easier. The second strategy here is that I would recommend, just as a normal kind of course of action, if you're a client of ours, you've heard me say this to you one-on-one, but I will put this out there for many of you, is it's not a bad idea to separate your bank account for your loans and your bank account for your assets. In other words, if you have a lot of loans with a bank, keep those loans there and open up maybe a checking account or something, for your business assets and your own personal at another bank. And the reason is this is kind of a risk mitigation strategy because we don't know what's going to happen. And God willing, you guys all will be fine and there won't be any hardships, financially or otherwise, especially if you're able to get the money. But if you have your assets and your loan accounts in one bank, it's very easy for the bank to reach in and take those assets, even though you're trying to work through some hard times. And we have already seen it. Thankfully, none of the dental banks are doing this. This is when you go outside of the dental world, there's less relationships and there's less loyalty. And so these other institutions are going in and taking accounts and taking monies that doctors have in other accounts inside that bank to fulfill some legal obligations on loans. So my recommendation is just separate it. You can always get rid of that and go back to what you were doing before once this is all over. But just for risk mitigation purposes, it's not necessarily a terrible idea. Now, if you didn't get the loan, right? If you didn't get a loan, actually, one last thing, right? I'm going to give you the gift. For those of you who did get the loan, I'm going to give you the gift now because it's mostly important to you. So we created a calculator for you to figure out on your own how much of your loan can be forgiven. Okay, so this calculator, you can just plug in some numbers, and I've tried to make it as simple as possible by breaking it out by week and all these other things, so that you can get a sense of what your forgiveness will look like. Now, my recommendation is that you use this for your own information, and then take this information to your CPA. Do not try to do this by yourself. To figure out the exact dollar amount of the loan forgiveness. And I've put a lot of disclosures on this so that no one, just relies on this because the rules are changing and every bank is slightly different. We've heard of banks that are requiring 90% of the employees to remain on and some other, rules, crazy rules, and some are just following what the government, has requested. So just be aware of that, but use this as a really strong tool to figure out what you need to do and how you need to do it if you're planning on trying to forgive most of your loan. Okay, so this is how you get it. You need to text the word PPP CALC. So PPP Calc, CALC. Text that word to the phone number 44222. Okay, so the phone number is 44222. You put that in the text message box like you would put anybody else's phone number. And then in the message portion of the text message, you put the single word, no space, PPP CACL. Okay, so PPP Calc. And what you will get, right, is you will get this calculator that you can use and fill in the blanks. And based on that, it will start doing some calculations for you. So you get a sense of what you need to do to get the loan forgiven. Now, remember, this program, the PPP program, was not meant to save small business. That was not the goal. The goal of the PPP program was to get you to rehire your employees so that there's less people on unemployment if you terminated them. This is a very important differentiation because I know many of you have questions about what do I do with my money if I'm not open yet? Well, we're recommending, as most CPAs around the country are, is to hold on to your money, pay the expenses that you have to pay, like your rent and utilities, but hold on to it until we have a little bit further guidance from the government. But work with your CPA closely on this. But if your goal is to maximize your refund, your forgiveness, if you want to maximize your forgiveness, then use this to figure out exactly where your monies are falling in terms of the 75-25% breakdown and all those details. And then speak to your CPA. Make sure you work with your CPA. Again, if you need a good CPA and your CPA is not helping you, let us know. We have a list of great ones that are willing and able to help you all day long. There's no strings attached to them. They're all wonderful people who know this material really, really well. If any of those CPAs are not CPAs that you are interested in, go to the American Academy of Dental CPAs website. They have CPAs locally around the country as well. And many of those are good. If you don't get along with any of them or you don't hit it off, just call me or email me and I'll find you somebody that's wonderful. So for those of you who unfortunately didn't get the loan, if you're in that group and you're not alone, okay, you're not alone. Hundreds and hundreds of thousands of you did not get the loan. And it's no fault of your own, right? It's no fault of your own, of course. So let's talk about that. So there's a couple of things I want to go through with you for cash flow purposes, because I know, the reason I researched this and kind of came up with some of these ideas was because nobody was really talking about them. But more importantly, I know the pain, I feel the pain that you all feel because I hear in your voices, in your emails, in your text messages about what to do in terms of cash flow because you're so worried about that, rightfully so. So here are some things to think about, right? So one is, a lot of you have been asking me, should I sell my stocks and bonds? Should I get out of this, of the market completely? I'm not a financial advisor, so I'm not going to give my opinion on that or what you should do. It's very factually specific. But what I can tell you is that one of the things you can do is, instead of cashing out your stocks and bonds, you can take what's called a securities line of credit on that. So now it may not be as high as you could have done a couple of months ago when the market was higher, but talk to your investment advisors, talk to banks and see what you can do with regard to that, because you may be able to take some cash flow, or you may increase your cash flow by taking a securities line of credit out on your stocks and bonds without having to actually sell them. So that's an important thing that might be good for those of you who were not able to get the PPP loan. In some of your insurance policies that you may have out there, there's some labor stoppage language that we have found. And so if you have one of these policies and you have some labor stoppage language, you might be able to defray some of the costs. They might be able to pay you some monies out of that policy as well as a result of that. Not all policies have them, but some have had them. So just kind of keep that in mind. If you want us to review that and see if it's in there, just contact us at the law firm and we'll help you figure that out. Make sure you do your cash flow analysis, especially if you have not gotten a loan. What that means is that you got to figure out really how much cash do you have on hand, and more importantly, what your burn rate is. And what I mean by burn rate is how much money do you have to spend on things that are not variable, your rent and your mortgages and your payments to the bank on the construction loan or the acquisition loan you may have, maybe some employees costs that you can't terminate because they're still answering phones. Figure out what your your burn is, your minimum burn is, and then how much cash you have on hand, so you can figure out how much you can last. And then I would play out a scenario of what happens when you start bringing people back. There's going to be a delay on AR, both from patients and from insurance companies, because not everything's just going to turn on like a flip of a switch. So just expect, what I would say is a 30, 60-day delay on payments. So kind of plan that in to your analysis so that you can really figure out, are you in a position that you can last a while, or are you going to really run out of cash? And if you are, then having contingency plans there The other thing is, if you have a whole life insurance policy, you can potentially take a loan against that whole life insurance policy. A lot of you, those are very expensive, really beneficial, policies, as part of your retirement plans long term. If you've done everything else you need to do, they are absolutely wonderful. So you may have a high cash balance there, and you may be able to take a loan out of that. Now, again, remember, these are things you need to work with your advisors and strategize on those. Some of them have interest rates that you have to pay back and things of that nature. So just work with them. But again, if you need a cash flow, those are some really good strategies. If you have had a line of credit out, if you do have a line of credit out with a bank, I would contact them to see if that line is still open. A lot of banks are closing the lines, so just kind of keep that in mind as well. Now, some other general concepts. Now, what should you cut? What should you not cut? We're getting a lot of questions around this. So there are some things that make sense potentially to cut back on, and maybe some things not so much. Obviously, if you need to terminate employees or whatnot, don't cut your A players. They are going to be the hardest for you to bring back. And so just focus on those. Don't fire your CPA until unless you are not getting the information you need and you need a replacement. Find your replacement first. Your CPA here is probably one of the most critical people in your business right now. So if you have a good one, stick with them, communicate with them. There's a lot of fantastic dental CPAs around the country. So keep with them. HR strategies. This is the worst time to let go of HR managers or HR solutions or whatnot. So make sure you're focusing on that because right now is the time. This is an HR moment, right? This is the time to make sure you're HR compliant so that you can stay compliant moving forward. And then marketing. I know marketing can be expensive, but remember, you may have to dial it down. You may have to do certain things, but don't cut it out completely because you need to communicate with your patients as you get ready to kind of come back online. Especially in-house marketing to your current patients is probably what I should have even focused even more on, is focusing on your current patients even more so than patients that you don't have right now. Now, 401k profit sharing, that is something you can cut. Talk to your advisor again, for 1 year or for this period of time, you may be able to kind of cut back on that, especially if you don't have the cash flow. Again, I'm not advising to do it, but it's something that's an option for you if cash flow is an issue. So make sure you speak to your advisors. All right. Now, we are very recently getting a lot of emails regarding the OSHA rules and products. Now, there are a lot of people who are trying to sell you masks and devices and things of that nature that they say, cures COVID-19 or protects it outright or does this or does that. They may, I don't know, right? But what I can tell you is that we don't know yet what OSHA is going to require. So my recommendation is, get the information you need, do your homework, do your research, sit tight though on spending until you figure out what OSHA will require you to do in the office. Because if there are significant structural costs that they will force you to do, you may need to spend the money on those things to be open as opposed to other items that may be luxuries. Now, does it mean that you shouldn't buy air filtration systems? I don't know. You need to do the research. There's arguments on both sides. I'm not an expert in those, but what I do know is that cash is king right now because we don't know what the next several weeks are going to look like. But it doesn't hurt you to wait until the end of April, because by then we should hopefully hear from OSHA. And if we hear from OSHA, you'll have better guidance on what to do next. All right. Shutdowns, we'll end on a couple of last things. Shutdowns versus opening. So I know that there's a lot of information out there that some large DSOs and other groups are opening up. They are doing it at their own peril. Just be careful of that. There is a lot of community backlash to it and other things. That being said, the decision to open up is not an easy one. And if you decide to open up at any point before the formal shelter in place is lifted, I would really think long and hard about that decision. I would look at your community. Are they a community that is open to that? Because there are a lot of communities around the state that don't really believe in what's happening with COVID-19 and things of that nature, and may be more okay with you opening up than some other communities where the feeling about it is much more serious. And so that can vary location by location by location, county by county. Some cities and counties now, like San Jose, is coming up with their own rules regarding emergency sick leave and emergency FMLE. I saw something just yesterday that basically the city of San Jose is doing away with the exemptions and creating their own rules. So everything we talked about earlier in terms of being less than 50 employees and all those exemptions, they are trying to get rid of it. And I think it may have been an ordinance that was passed. So I'm still trying to get more information. So that may start to happen. So my point to that is just look at it from a local perspective about whether or not it's a good decision for you to open up. All right. So finally, a couple last things. If you want the calculator, as I mentioned, I'll give you that again. The calculator, you can get it by texting the word PPPCACL to the number 44222. Okay, the phone number that you text message is 44222, and then the word is PPPCACL. Okay, so calc. Now, if you're a Vision Source optometrist, you have a meeting tonight where Vision Source has created a really fantastic calculator themselves. I saw it yesterday. I thought it was amazing. I'm a little bit jealous of it. Mick did an amazing job. So make sure you go to that call and you get that calculator, because that's really specific to optometry as well. So you can use ours, you can use Mick's. You'll be in great shape either way. But make sure you go there. That's a really great value add for you all. So that's all I have. I know I took a lot of time today. I'm sure we have a lot of questions, so I'm going to look here and try to answer as many of these as I can today. And then if I don't get to your question, because we are running long, I will promise you we will follow up with you if you email us either through Facebook or individually. Okay? So how do I apply for the exemption under the FFCRA? Great question. So the law here actually benefits us, because what it says is that the way you apply for the exemption is that an officer of the business, of the corporation or the entity, has to make a designation that the exemption applies. Okay, so it's all on the officer of a company. So if you're the owner or the office manager and you're an officer of the business, you can make that determination. On our resource page at HR for Health, we have some documents we've created for our clients that you can use to document that. That may now be available to non-clients as well. I'm not exactly sure, but reach out to HR for Health if you want that, and it's there for you. So what if my associate is an independent contractor? Are they eligible for FFCRA? The answer is no. Independent contractors are not eligible for FFCRA. Only employees are. Another question, I'm staggering employees, so each person is on site solo. Do I still need to measure temperatures? The answer is yes. I would measure anybody, any patient or employee that walks into your office. And the reason, as you can imagine, is that if your employee has a temperature, then they are infecting the office. And so you would have to not only send them home, but you would have to wipe down everything, and everything that they touch, of course, could infect other people in the office. So you absolutely need to take their temperature and make sure that to make sure that they are not sick. Is taking employees' temperature valid in Florida? This is a CDC recommendation, so it's a nationwide recommendation in terms of the temperature. I don't know if the recommendations in the state of Florida are that you document that if they do have a temperature, but we can look that up for you if you like. Just contact HR for Health. But in California, if they have a temperature, you definitely need to, if they have a high temperature, everybody has a temperature, hopefully. If they have a high temperature, you need to measure it and document it in your files. Can you lower wages because production will be much lower? So I'm assuming you're talking about hourly employees. And so if there's a business need, you can always, either pre-COVID or after, or during COVID, you can reduce employee salaries or hourly wages, of course. but you do have to make a new offer of employment to them. And if they don't accept that, then you're in essence terminating them. So I would say be strategic about it. If you're working with a consultant, work with a consultant. But if you're not, then I would say come up with a plan with the employee where you say, look, because of our lower revenue, we want to lower your salary by this much for this period of time, but we're hoping to come back, to normal, and we can go back to normal wages or whatnot. Don't expect to keep those employees, by the way, if you significantly change them, as they may change. So you just have to be aware of that. Are there restrictions on what the idle can be used for other than not double dipping for payroll? Technically the idle loan, which many of you probably heard, changed from being a $10,000 grant to basically being $1,000 per employee with a $10,000 cap. It can, it's technically supposed to be used for maintenance of the business and threat of the business under idle. So you can't use it for personal reasons, but you can use it for any real business reasons. That being said, although it's not in our calculators or whatnot, for a lot of different reasons, but the idle loan, if you do end up getting this grant, it may be offset by the PPP loan. So just kind of keep that in mind as well. When you apply for PPP, you should have told them that you had applied for the idle loan or whatnot when answering those questions. Is there a partial PPP forgiveness if you bring back part of your team based on available workload? So great question. So every bank right now is handling this a little bit different. So some banks are requiring that you bring back 90% of your employees, plus their payrolls can't be any lower than what they were, in the previous quarter. The federal government has been a little bit more relaxed than that, believe it or not, and so they have their own rules. What I would say is, without making sort of too big of a general statement, because it is very different, is take a look at the promissory note you got from your bank. Very important. Take a look at that, see what those terms say, but more importantly, talk to your banker. You have a great relationship, I'm sure, with them. Talk to your banker and figure out exactly what those rules are that they are going to look at when they're thinking about forgiveness. Very important, because they are the ones that are going to get the paperwork and they're going to verify that, what percentage of your loans are forgiven or whatnot. Now, if you do reduce your employees' salaries more than 25%, that will be offset in terms of the forgiveness. So you will be able to forgive less, and our calculator goes through that analysis for you automatically. Okay, and then how does the 8 weeks of forgiveness work for the PPP loan if the shelter place isn't lifted? So we were hoping to hear by now that the government has changed its stance on the 8-week term that you have to pay. You have to use the monies that you're getting from the SBA. That 8-week period right now has not changed. So from the time your loan originates, in other words, from the time you get your monies, and again, your bank will tell you exactly that date, your 8-week period starts. And regardless of whether you're open for business or not, as of right now, will it change? No one knows. No one knows. Remember, the point of the PPP is not to save small business. The point of the PPP is to bring back employees to work. So as a result of that, we don't know if they're going to change their 8-week time frame, to be quite honest. And so that is a problem, I know, for most of you, because you're closed. You don't have employees working right now, and you don't have payroll. Again, work with your CPAs. Our recommendation, as many CPAs, dental CPAs around the country are saying, hold on to your cash. Just wait until the second half of that 8-week period. Maybe we'll have some more information. You might be able to implement some strategies like paying, expenses ahead of time. You might be able to bonus your employees. There's a lot of strategies out there. Work with your CPA. There's not one magic bullet, but there are a lot of creative ways of doing it. Again, remember, work with your banker, work with your CPA on those, because they're the ones that the banker specifically is going to be the one who forgives your loan in their documentation. All right. Okay. So it was a pleasure talking to you. I hope all of you are safe and healthy. Please continue reaching out to us. We'd love to hear from you. We'd love to answer your questions. Of course, just realize we are trying to get to everyone, so there may be a day or two delay on some communications, but we will absolutely get to you. And hopefully, we will come back when we have some more updates, maybe next week. Be on the lookout for some of the other webinars with CDA and other organizations. But as always, be well, be healthy. We'll see you soon. Bye.